So we will talk about what kind of animal we need to do echocardiology. So first, if the animal cough. So in traditional way, people always think about if the animal cough, it could be problem of the lung, but actually it might be because of the heart. So especially if it is a old animal, if the animal coughs, especially during the night, and then we need to think about heart. So we need to do echocardiology. And if the animal breathe very fast and very difficult, we need to think about heart also. Especially sometimes especially for the cat, sometimes the owner bring the cat to the hospital to do the examination, and the owner only found that the cat breathes very fast at home, or sometimes have a open mouth breath. And then they bring to the hospital, and then they do the examination during the time when they take blood, or sometimes they do X-ray, and the cat just died suddenly, and that will cause a lot of problem for the hospital. So we need to explain. We need to let the owner know that if the animal have this kind of clinical or sign, it could be because of the heart. So we need to tell the owner if the cat has heart problem, might have the risk of heart sudden death. And sometimes if the animal just collapsed suddenly, and we need to also do very carefully clinical examination, or we need to ask the owner the information about how the cat or animal was doing when the animal have the clinical sign of collapse, to differentiate from the collapse from the seizure. If the animal have the clinical sign of collapse, we also need to think about heart, and then we need to do echocardiology. Ascites. So if we find the animal, the abdomen is getting bigger and bigger, and then if we find the fluid inside, especially if it is large animals such as the golden retriever and Labrador. Of course, golden retriever and Labrador in China are large animal. In other countries, could be only middle-sized animal. We need to also think about could be because of the right side of the heart, and if the animal have the clinical sign like the tango, the color of tango is blue or something, we need to think about could also be because of heart and limp. So if the animal just suddenly have the problem of the neck, and normally we'll think about could be because of the bone or joint or muscle, but also we need to think about heart. Sometimes the animal have heart problem and can also have this kind of clinical sign. And if you do the examination and you find the murmur, of course not every murmur case have heart problem, but it could be. So we need to tell owner to do further examination. If we find the abnormal heart shape on X-ray, we also need to think about heart, and we need to do the heart ultrasound. So when we do the heart ultrasound, we need to choose a very quiet environment, and also we need, sometimes I will give the animal some oxygen before we start to do the heart ultrasound. And we also need to let the owner know that if the animal have heart problem and have the very high risk of suddenly death. And so we will talk about the first view, the 4-chamber view. So the animal lay on right side. We put our transducer from the right side, and we need to find the 4-chamber lung axis. So this is lung axis of heart, and this is 4 chamber. This is left atrium, left ventricle, right atrium, right ventricle. And we needed to make the right ventricle like this view. And in this view, we can check the 4 chambers. And also we need to check the mitral valve, trapezial valve. And at here, we also can check the left ventricle. And sometimes if the animal have the overflow of the left ventricle, we need to also use this view. This is 4 chamber lung axis view. And the right side left ventricle outflow view. So this is left ventricle, this is left ventricle, and this is aorta. So sometimes we also say it is a 5 chamber view. The 5 chamber is the first chamber is left atrial, left ventricle, second, left atrial, left ventricle, and aorta. Of course, aorta is not chamber, but at here, in some books, we call it 5 chamber. 5 chamber. So at here, we will check the valve of the aorta. And also we need to check the blood flow at here. So this is the left ventricle outflow view. From this view, we turn our transducer 90 degrees, and then we will see the short axis. So at short axis, there are some views are very important. This view, we call it mushroom view. And this is left ventricle, right ventricle, and here is the pulmonary muscle of the left ventricle. And then we adjust our transducer, and we can see here we call it fish mouth, because the valve open and close, looks like the fish mouth, open and close, open and close. And then we we put our cable a little bit higher, and then we will see this view. This is quite important view. Here is aorta, and here is the valve of the aorta. So looks like the mark of bends. So that's why sometimes I make joke with my students, and I told them that, okay, everyone work hard to do ultrasound, and finally you will have your bends. Here is the bends, and this is the left atrial, right ventricle, and here is the pulmonary artery. This is the pulmonary valve. At here, we can check if it is a pulmonary valve regulation or have the stenosis or have the hypertension. And then from here, we move a little bit our transducer, we can find the branch of the pulmonary artery. So this is a short axis. Let's see the ultrasound picture. Here is the mushroom. This is the left ventricle. This is right ventricle. And here is the mushroom. And here is the fish mouth. If you do ultrasound, you will see this part open, close, looks like fish mouth. So this view is the aorta, left atrial, left ventricle, and the pulmonary ventricle. Here, the bends is not so clear. We use this view to see left ventricle and the aorta. So should be smaller than 1.6. Sometimes in clinical case, if it is 1.6 to 1.8, I will see if the patient have any clinical sign or not. If the animal already have clinical sign like cough, I will give some medicine. Normally, if this is higher than 1.8, from X-ray you will see pulmonary edema. You need fluoxamate to help the animal. And here is the pulmonary valve. After we finish the right side, we move the animal from the right side to the left side. So the animal lay on left side. We put our transducer from the left side and to see the 4 chambers. From the left side, we have 3 views that we can check. Here is one of the most important view. We will only talk this view this time. We'll talk other view in the future. And this view is a 4-chamber inflow view. So the blood is from here to here. So it should be from here to here. So that means it should be red. If it is blue, that means from left ventricle go to the left atricle. That means mitral valve regulation. So at this view, we will check mitral valve and also check trapezial valve. We will see the valve. And let's see the ultrasound image. So the ultrasound image should be like this. You will see the left atricle, left ventricle, right atricle, right ventricle, and the right side should be only 1/3 of the left side. If it is getting larger, so that means have a problem. So these are all the views that we always use during the echocardiology. So let's go again to see the standard views. The first view is the 4-chamber non-access. Second is left ventricle outflow view. Sometimes we call it 5-chamber. And short access mushroom, fish mouth, left atricle and aorta, and the pulmonary valve, and the 4-chamber